I think it really comes down to, understanding that health is really the goal, right? I think that for the healthcare system, the goal is often cure or treatment or
Mm,
providing like a solution like surgery to a problem. But for the patient, I mean, I think it really comes down to like they want to live the healthiest years on this planet that they possibly can.
mhm,
And I think the healthcare system focuses maybe too much on life expectancy or lifespan, and a lot of people are starting to use this term health span, which is
mhm,
that like how can we improve like the time here?
mhm,
Like how can we focus the efforts that we have both from a clinical perspective, and we have certain tools that can improve quality of life as well as improve length. But a lot of that is centered around what we do from a prevention perspective and for public health perspective. When we look at models that have been successful at doing that at much less cost than here in the States, I mean, you look at places like Costa Rica, where there is a very like entwined and interconnected public health system with
mhm,
like the healthcare system, like such that every family has someone who goes out and visits them. We call it community health workers, some people call it
mhm,
promotoras, but um, but really having someone who isn't necessarily a clinician per se, but someone to what you had mentioned to help them navigate some of the challenges of
mhm,
managing their health both at home
mhm,
and when they have to enter the healthcare system and when they return to home. In it's in those gaps I think
mhm,
that we do a poor job. It's in
mhm,
those transitions between being healthy to having a problem to getting treatment to going back to trying to get to a new state of health. And we do not have the tools and the people and the workflow and an understanding of how to make those transitions happen seamlessly. And I
mhm,
think that they are muddled with opportunities for folks to have to revisit emergency rooms, to have to ultimately be rehospitalized, or to simply just get lost in
mhm,
the complexity of the system.
mhm,
So really trying to think of ways like to help, to your point, navigate people along this path,
mhm,
like is really really important, and it's where most of my patients get lost. Like when it
mhm,
comes to patients who, not just from a cancer perspective, but like lots of patients who show up to emergency rooms seeking care, like ultimately struggle to then navigate what's next.
mhm,
And so how do we do that? And I think that where shared decision making is connected to that is that when we do that, when we actually understand the patient's journey along the entirety of that path, from being at home to having a problem to seeking help to then going back to being healthy, when we know what that journey looks like,
mhm,
then we can better understand what they want to help them along that journey, right? Because
mhm.
we're taking it with them
Yep.
instead of you're just here in my clinic and now you're gone. Like
Mhm.
whatever happens after that is
Yep.
between you and someone else. But if we are really taking that journey with our patients,
Mhm,
like in a real shared way, like then I think we come to better decisions
mhm.
about their care.